Let's onboard onto CancerBot and show the new trial goodness scoring and Navigator-bot interview features. So what disease? Multiple myeloma. What stage? 1. Yes. BRD. First therapy, when? October last year. Outcome was stable disease. No second line therapy. No supportive therapy. US. Oh, 6851. Age 50. Male. ECOG is 0. Yes, more diagnostics to be eligible for more trials. Yes, contraceptives. 100. Progression active. Okay. We see here a list of eligible trials and potential trials. I want to show the, and they're scored by goodness. We'll just explain that in a minute. I want to show some potential trials that we can get into if we answer a few more questions. Here's a nice phase 3 trial, only 28 miles away, score of 54. Okay, so what is this goodness we speak of? So there's 4 factors: distance, risk, benefit, and patient burden. This is a relatively good trial for us. We can change the weights, however. You can see they're equally weighted now. If we change the weight to maybe emphasize distance, this would score even higher because it's so close. If we wanted to emphasize minimizing risk, it would score even higher. You can see that this is very good distance, fairly low because it's close. Good risk because it's fairly low. The benefit is modest. It's not clear. It's a huge benefit, and it fairly high patient burden. So it's nice that we have multiple criteria, because for a patient that was worried about patient burden, maybe it isn't a great trial. But we're not quite eligible. Notice it says you're not eligible. We haven't given it all the information. We only answered, the bot only asked questions about the things that were likely to make many trials eligible. So we say we had no pre-existing conditions. It eliminates a lot of pre-existing conditions. Now it's going to ask us for our kappa and lambda. If we're not abnormal, it's not going to let us in. We can do that right from here. We can also do it from the patient info form. Okay, we're fully eligible now. So I say I'm interested, and the bot starts and says it'll be asking you questions so we can understand the patient burden and risk. Take your time. Do you understand the trial involves treatments like talquetamab, pomalidomide, and teclistamab? Yes, that's why I was interested. I am, but I want to hear more about the side effects. I am aware, but I want... Oh, sorry, I already said yes. I said yes that I knew about them. What should I do? I'll say no. Okay. Important for the study team. Okay, now I understand. Okay, how often you'll need to visit the clinic? I'll say no, so it can give me more information. Every 2 weeks initially, then less frequently. Yeah, it's clear now. Yes, I'm comfortable with it. Yes, I do understand the expenses. I have discussed it with my family. Do you understand that your participation in the trial is voluntary and you can withdraw at any time? Yes. Yes, I'm aware of other treatments. I had one. I understand it may not affect my general health. Yes, I'm comfortable with the use of data. I don't anticipate No difficulties. Yes. Yes, those are all my questions. Okay, and we'll be contacted by the patient navigator, by a patient navigator to discuss this, and the patient navigator will have access to all of this information.